tell me your name and date of birth?
Matthew Baines, 41789.
Okay, hey Matthew. My name's Carly, and I will be the DNP student taking care of you today. So what brings you in today?
Need to establish care.
Okay. Have you seen a provider previously?
I have not.
Okay. Can you tell me a little bit about your health history?
Not much to say. I had hydrocele when I was a kid. That's about it.
Okay. So you had surgery for that hydrocele? How old were you?
8.
Okay. And any other previous health diagnoses?
No.
No other surgeries?
Nope.
Okay. All right. And tell me, do you have any drug allergies?
Nope.
No, none that you know of? Do you have any food allergies or environmental allergies?
Nope.
Okay. All right. Good deal. Okay. Well, tell me a little bit about your social history. Do you work?
Yep.
Okay. What do you do for a living?
Superintendent at a construction company.
Okay. And are you married?
Yep.
Okay. Do you and your wife live together?
Yep.
Okay. And what about, do you have children?
Yep. 1 little girl.
Okay. And do you feel like you have good coping mechanisms for your stress in your life?
Yep.
Okay. Do you drink?
Yep.
How much do you drink?
4 ounces of bourbon a week.
Okay. And do you smoke?
Yep.
Okay. How much do you smoke?
Half a pack a day.
Okay. And what about, do you use any illicit drugs?
Nope.
Okay. Including marijuana?
Nope.
Okay. Do you vape?
Yep.
Okay. How much do you vape?
1 disposable every 2 weeks.
Okay. All right. And can you tell me, as far as your family, are your parents still living?
Yep.
Okay. Did your mom have any health issues?
Just arthritis.
Okay. And what about your dad?
Nothing.
Okay. And what about your grandparents? Are they still living?
No.
Okay. What did your paternal grandparents die from?
Old age, both of them.
Okay. And do they have any chronic health issues that you're aware of?
Grandpa had diabetes, that's it.
Okay. And what about your maternal grandparents?
Congestive heart failure and heart attack.
Okay. And that was your maternal grandmother? Okay. And what about your maternal grandfather? Any health problems?
Heart attack.
Heart attack. Okay. All right. Okay. And you have no health problems that you're aware of at this point in time. Okay. What medications are you taking?
Omeprazole and Chantix.
Okay. How long have you been on omeprazole?
2 weeks.
Okay. What dose do you take?
Smallest dose they give.
Okay. And how often do you take it?
Every other day.
Okay. And the Chantix, you said you've been on it for how long?
4 days.
Okay. And you just following the dose pack on that?
Yep.
Okay. All right. Good deal. Okay. Well, I'm going to wash my hands over here, and I'm going to don a pair of gloves. I'm going to come over here, and we're going to just do a review of systems. So we're going to go from your head down to your toe, and we're going to just kind of like look at everything from top to bottom. I will ask you some questions and lay hands in places and touch and listen with my stethoscope. Is that okay with you? Okay, wonderful. And then we had a set of vital signs up on this machine just a second ago. It was 134/80, and then heart rate was 104, and O2 was 97% on room air, and temperature was 98.4. Okay, so we're gonna come over here, and the first thing we're gonna do is we're gonna look at your head. Okay, are you having any problems with your head?
Nope.
Any headaches?
Nope.
No. Okay. Have you noticed any like lumps, lesions, hair thinning, anything like that? No. Okay. And you're completely and totally oriented to your environment. You know where you are and what's going on. No dizziness, no lightheadedness. No. Okay. All right. So I'm gonna touch on your head, and I don't feel any lumps or lesions. I don't feel anything abnormal. His head is symmetric and round. It's the appropriate size for his age. His hair is appropriate for his age. He's not balding. There's no thinning of his hair. He has appropriate beard hair that is also not thinning and doesn't have any like missing patches or anything like that. It's symmetric on both sides. Okay, so now we're going to move on to your eyes. So I don't see anything as far as his eyes. His eyes are symmetric, and there's not any abnormality there. Pupils are round. Do you have any discharge with your eyes?
Nope.
No. Any issues as far as like itchy eyes, red eyes, anything like that? No, no swelling, nothing like that. Okay. So I'm going to take this light right here, and I'm going to just shine it into your eyes so that I can, if you'll look at my nose really fast. Okay, wonderful. Very good. Okay, so pupils are round, reacted to light, and his sclera is white, and his conjunctiva is his conjunctiva is pink, his sclera is white. And so, yeah, okay. Now we're gonna move on to your ears, okay? So are you having any problems with your ears?
Mm-mm.
No, okay. Any pain or tenderness when I palpate?
Mm-mm.
Nothing on the external ear hurts at all?
Nope.
Okay, good. As far as your internal ear, have you noticed any discharge, anything like that?
Nope.
Any ringing of your ears, any loss of hearing?
Nope.
No, okay. All right, I'm gonna take a look on the inside of your ear. Is that okay? All right. So I'm gonna pull back on the pinea right here, and then I'm just gonna stick this in, and I'm gonna lay eyes on the inside. Okay, and I can see your tympanic membrane. It is intact, and I see the pearly white portion of it. And I'm gonna grab another one of those since that hit the floor. Give me just 1 second. All right, so I'm gonna have you turn. We're gonna look at the other ear. We're gonna do the same thing. We're gonna pull up and out, and I'm gonna stick this on in and look, and I see your tympanic membrane. It looks good. It's intact, and it is pearly white. I don't see any excessive earwax or anything like that. It all looks very good. So now we're gonna move on to your nose. Do you have any problems with your nose?
Nope.
Any discharge from your nose?
Nope.
No? Okay. It looks like it is symmetric. There's no issues here. The septum looks like it is not deviated. I'm gonna push down right here. I want you to breathe out. And again, very good. Okay, and then I'm gonna look up and in your nose. Okay. Mucous membranes inside the nose are pink. There's no excessive drainage, no signs of bleeding, nothing like that. It all looks very good and intact. Okay, so now we're gonna move on to your mouth. Do you have any problems with your mouth?
Nope.
Okay, no ulcers, no issues with like your mouth bleeding or gums bleeding, nothing like that? Okay, good. When's the last time you saw a dentist?
A few months ago.
Okay. When's the last time you saw an optometrist?
A few years ago.
Okay. And then were there any issues with the dentist when you went?
Nope.
No? Okay. Have you had any oral surgeries or anything like that?
A couple root canals.
Okay. Any difficulty swallowing?
Nope.
Okay, very good. All right, well, I'm gonna take a look on the inside of your mouth. If you'll just open your mouth really wide, stick your tongue out and say, ah. Okay, good. All right. Tonsils are gonna be a 3+. They're a little bit enlarged, but you're not having any trouble swallowing or anything like that. Okay. Do you snore at night?
Yep.
Okay, all right. And what about I noticed a few like fillings in the back of your teeth. Yeah. Have you had a lot of problems with cavities throughout your life? Okay.
Yep.
All right. Okay. So, mucous membranes are pink and moist. Looks like everything is pretty normal inside the mouth. I don't see any ulcers, no lesions, nothing like that. Okay, so now we're gonna move on to your neck. His neck looks like it's symmetric. I don't see any like lesions, nothing sticking out like that. I'm gonna palpate right here. I want you to swallow. I'm feeling for his thyroid. Okay, good. One more time. Okay, good. I don't notice anything abnormal. Thyroid feels like it's normal. There's no nodules or anything noted there. So everything is about the neck is intact. I'm gonna now try to palpate for your lymph nodes. Okay, so I'm gonna palpate in a few different places. We're gonna palpate here. Okay, nothing noted there. We're gonna palpate here. Nothing noted there. We're gonna palpate. All right. Nothing noted there. No tenderness on any of that, right? Okay. There's no noted fixed hard nodules or anything like that. Everything seems to be pretty intact and not swollen or irritated. Have you had any like generalized illness or anything like that?
Nope.
Okay, good. All right. Okay, so at this time I'm going to ask you to take your shirt off if you're comfortable with that. Okay. So I noticed that the skin is a normal color. It's pink. There's not any lesions, lumps, nothing that stands out as far as abnormalities. A few pimples noted to the shoulder and back, but everything else looks pretty normal. So at this point in time, I'm gonna lay eyes on your chest. Can you sit up really big and straight? Good. Okay. I'm gonna have you take some deep breaths for me. Again. Good. Okay. So respirations are symmetric, that equal on both sides, and respiration rate is regular. O2 sat was 97% on room air. You having any difficulty breathing?
Nope.
Have you had a cough at all?
Nope.
Okay, wonderful. All right. I'm going to go down your back. I want you to say the words 99.
99. 99. 99.
Okay, good. Tactile fremitus noted, and I can feel in all sections. I'm gonna take a listen to your lung sounds now, okay?
Mhm.
So if you could just take a big deep breath for me. Again. Slow down. Very good. All right, breath sounds are clear in all areas. So now what we're gonna do, I'm gonna percuss really fast, okay? So all right, and I hear some resonance all the way through. Any tenderness or anything with palpation back there?
Nope.
No? Okay. All right, now I'm gonna have you to lay back on your back. All right, and I'm going to assess your chest. I don't notice anything as far as abnormalities on the chest. There's no distinct lumps or lesions, nothing that sticks out. I do not see his pulse at his PMI right here. There's no jugular vein distension. Everything as far as his chest looks pretty good and intact. If this was a normal examination, I would listen to the front portion of his lungs. However, because we have listened to the posterior section, we won't repeat that. So now at this point, I am going to listen to your heart. If you will sit back up for me for just a second. We're going to listen in 5 different spots. We're going to listen right here, right there, right there, right there, and right there. All right, S1 and S2 are noted. No abnormal gallops or Ruiz noted. Murmurs, sorry, no abnormal gallops or murmurs noted. I'm also going to listen to your carotid really fast, so if you'll just look straight up for me, perfect, thank you. Okay. No bruit noted. I'm switching over to my bell to listen to his chest. Same thing, no abnormal gallops or murmurs. Very good. Okay, so now I'm going to check your pulses, so if you'll just sit back for me. All right, 2 plus there, 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 and 2 plus there. Okay, I'm gonna slide your socks off so that I can look at your capillary refill down your toes. That works. I appreciate that. Okay, so I'm just gonna push down on your nail right here. All right, capillary refill, less than 3 seconds. Okay, all right. And it looks like he has good circulation based off of his hair growth pattern on his feet and good capillary refill. Same thing on your fingers. I'm going to press on your fingers and just make sure that we've got good refill to your fingers. And we do. And same thing, he has good hair growth on his hands, which would indicate to me that he has good circulation. Okay, so at this point in time, I'm going to assess your abdomen. So if you'll lay back for me. All right, and just inspecting his abdomen, I don't see anything as far as lesions, no lumps, nothing that stands out to me abnormal, just laying eyes on it. So at this point in time, I'm going to listen, okay? Vowel sounds are normal active in all quadrants. Now I'm going to percuss. Okay, I hear tympanic sounds all the way throughout. Now I'm going to do a light palpation. Any tenderness
Mm-mm.
on palpation? No? Okay. Now I'm gonna do a deeper palpation. Okay, noted to feel his liver. Noted to feel his spleen on this side. Kidneys are not palpable. Okay. Abdomen is flat. There's no abnormality there, and I don't feel any masses or anything like that. Are you having any problems with weight loss, weight gain?
Nope.
Any issues with, you said you're on, you can sit up. Any issues with indigestion or anything like that?
Yep.
Yes? Okay.
That's fine.
And that's why you're on the omeprazole? Okay. And is it helping your symptoms?
It is.
Okay. And what about constipation, diarrhea?
Nope.
No nausea, no vomiting?
Nope.
No blood in your stools?
Nope.
Okay, very good. Okay. And what about urination? Are you having any trouble with urination? Any pain or burning with urination?
Nope.
No. And are you waking up in the middle of the night to go pee?
No.
No? Okay. And have you noticed that your urine is just like a clear color, no like sediment or anything like that in it? Okay, and it's not like a weird brown or anything like that. Okay, very good. Okay, you're welcome to put your shirt back on if you would like to. Okay. Alright, so at this point in time, we're gonna assess your musculoskeletal system. So we're gonna assess your strength. Okay, so first thing I want you to do is to shrug your shoulders for me. Okay, I want you to lift your knees up. Good. Okay, can you do a half moon and kind of lean side to side? Okay, very good. Whoop, you okay?
Yeah, I'm
Okay,
good.
can you bend down towards your toes?
Mhm.
Okay, good. Any pain or anything like that?
Nope.
Any joint swelling, any joint tenderness?
Nope.
Any muscle pain?
Nope.
No? Okay. Are you able to perform your activities of daily living like pretty normally?
Yep.
Okay, very good. All right, so I'm gonna palpate on some of the joints, just kind of feel of them, okay? No swelling, no tenderness noted there. All right, we're gonna feel in your fingers, no swelling or tenderness noted there. No pain?
Mm-mm.
Okay, good. All right, I'm gonna feel of your elbows, no swelling, no tenderness there, no swelling or tenderness there. All right, what about your shoulders?
Fine. Good.
Okay. All right, are you able to lift up on your shoulders? All right, lift out on your elbows. Okay, good. Lift up on your hands. Okay, good. Take your hands and do this back and forth. Okay, good. Put your pointer finger to your nose and out. Again, and out. Okay, and other side, and out, and out. Very good. Okay. All right, I'm gonna have you stand up for just a second. Okay. All right, and I'm gonna palpate on your spine. Any pain or tenderness there?
Nope.
No, okay, no lesions noted, nothing abnormal there. Okay, palpating on the hips. Those joints feel like they are also no pain, no tenderness. No?
Mm-mm.
Okay. And they feel like they are also not swollen, nothing like that. Are you able to bend down to touch your toes?
Yep.
Okay, very good. All right, let me have you have a seat again. Okay. I'm gonna check your knees now. Your knees don't feel like they are too bad. Any pain or tenderness?
No.
No? Okay, are you able to straighten your leg out for me?
Mhm.
Very good. All right, bend it back. Again. Okay, good. All right, then we're gonna check your ankles. Ankles feel okay? No pain, no tenderness?
Yeah. No.
No? Okay. All right, and are you able to lift this foot up and down? Very good. Same thing. Okay, wonderful. All right. Okay, so now I'm gonna assess your reflexes. So we're gonna assess right here. Just relax it. Okay. All right. I'm gonna assess right here. Just relax. Okay. All right. Same thing over here. Okay. Reflexes intact up top. Then we're gonna do down here. Ready? Okay. Good. All right, then we're gonna do down here, and okay, very good. Okay, all right. So now, let's see. I'm gonna have you run your shin going down your heel going down your shin. Very good. Other side. Good. Okay. All right. And I think that's really just about it. No problems with your joints, no pain with your joints, no problems with your stomach, no issues with urination,
Mm-mm.
nothing with your heart, nothing with your lungs.
Mm-mm.
Okay, nothing with swallowing, nothing with your throat. Your
Mhm.
lymph nodes weren't palpable. You haven't been generally sick. You haven't lost any weight or gained any weight unintentionally. We are trying to quit smoking,
Mhm.
and we have a little bit of indigestion, but our medications are helping with both of those things. Okay. All right. Well, do you have any questions for me?
Not right now.
Okay. All right. Well, we will plan to follow up.
Okay, sounds good. Thank you.
Yes, sir.